through taxing middle-class families, I'm going to be opposed to that because I think there are better ideas to do it. Now, I have not yet seen what the Senate Finance Committee is producing. They've got a number of ideas, but we haven't seen a final draft. The House suggested a surcharge on wealthy Americans, and my understanding, although I haven't seen the final versions, is that there's been talk about making that basically only apply to families whose joint income is $1 million. To me, that meets my principle that it's not being shouldered by families who are already having a tough time. But what I want to do is to see what emerges from these committees, continuing to work to find more savings, because I actually think that it's possible for us to fund even more of this process through identifying waste in the system, try to narrow as much as possible the new revenue that's needed on the front end, and then see how we can piece this thing together in a way that's acceptable to both Democrats and I hope some Republicans.
Your job to get a deal done?
Absolutely, it's my job. I'm the president, and I think this has to get done. Just a broader point. If somebody told you that there is a plan out there that is guaranteed to double your health care costs over the next 10 years, that's guaranteed to result in more Americans losing their health care, and that is by far the biggest contributor to our federal deficit, I think most people would be opposed to that. Well, that's the status quo. That's what we have right now. So if we don't change, we can't expect a different result. And that's why I think this is so important, not only for those families out there who are struggling and who need some protection from abuses in the insurance industry or need some protection from skyrocketing costs, but it's also important for our economy. And by the way, it's important for families' wages and incomes. One of the things that doesn't get talked about is the fact that when premiums are going up and the costs to employers are going up, that's money that could be going into people's wages and incomes. And over the last decade, we basically saw middle-class families, their incomes and wages flatlined. Part of the reason is because healthcare costs are gobbling that up. And that's why I say if we can, even if we don't reduce our healthcare costs by the $6,000 that we're paying more than any other country on earth, if we just reduced it by $2,000 or $3,000, that would mean money in people's pockets. And that's possible to do, but we're going to have to make some changes. We've got to change how healthcare is delivered to the healthcare delivery system works so that doctors are being paid for the quality of care and not the quantity of care. We've got to make information technology more effective. We've got to have the medical system work in teams so that people don't go through 5 different tests. Those are all critical to do, and we can do them. Now, I understand that people are feeling uncertain about this. They feel anxious, partly because we've just become so cynical about what government can accomplish that people's attitudes are, even though I don't like this devil, at least I know it, and I like that more than the devil I don't know. So folks are skeptical, and that is entirely legitimate because they haven't seen a lot of laws coming out of Washington lately that help them. But my hope is, and I'm confident that when people look at